Hello everyone, welcome back to my YouTube channel Midcode Education. So in this live, I'm introducing a new chapter-wise guidelines. ICD 10 CM chapter-wise guidelines. Okay, so let us start the 2025 ICD 10 CM guidelines. First chapter: certain infectious and parasitic diseases, A002 B99. It is the range of chapter 1. Okay. So let us check the guidelines. First condition: human immunodeficiency virus, HIV infection. Okay. So HIV infection, in this case, code only confirmed cases. First cases, code only confirmed cases. Okay. So code only confirmed cases, HIV infection or illness. This is an exception to the hospital inpatient guideline section. Okay. So confirmation does not require the documentation. You don't have to code. Okay. Only for confirmed cases. Code only for confirmed cases. Okay. And next is selection. Okay, selection and sequencing of HIV code. Selection and sequencing is related to first condition: a patient admitted for HIV related condition. Mm, Okay. A patient admitted for HIV related condition. If a patient, the principal diagnosis should be B20. HIV. What is the code of HIV? B20 is the code of HIV. Okay. The full form is human immunodeficiency virus. Okay. Followed by additional diagnosis code for all reported HIV related conditions. So, first of all, a patient is admitted for HIV related condition. First code only the principal code B20. After that, you have to code the other additional diagnosis codes. Clear? And next is an exception to this guideline. If the reason of admission is, there is an example, okay? If a reason of admission is hemolytic uremic syndrome associated with HIV disease. So this is the uh, uh, question, or this is the documentation. Okay, so assign the code D59.31 is for hemolytic uremic syndrome, followed by the code B20. Okay, so first of all, you have to code the in confirmed cases, first of all, code B20. Otherwise, you have to code the appropriate diagnosis. Okay. Second one, a patient with HIV disease admitted for unrelated condition. Okay, unrelated condition. So, how to code? A patient with HIV disease admitted for unrelated condition. How to code? Okay, such as unrelated conditions such as traumatic injury, leg fracture, etc. Whatever. So, the code for the unrelated condition should be the principal diagnosis code. Okay. Other diagnosis would be B20 followed by additional diagnosis code for all reported HIV related conditions. So, HIV diseases admitted for unrelated condition. So, you have to code the unrelated condition first of all. After that, you have to code the HIV disease. Clear? Next is whether the patient is newly diagnosed. Okay, newly diagnosed person, how to code? The patient is newly diagnosed or has had previous admissions or encounters for HIV conditions is irrelevant to the sequencing decision. Okay, irrelevant. Uh, Next condition is asymptomatic human immunodeficiency virus, HIV. So, ISA21 is the code for asymptomatic. Okay, asymptomatic means uh, no symptoms presented. Okay, no symptoms are presented. It's called asymptomatic. Symptomatic means symptoms are presented. Clear? So, asymptomatic human immunodeficiency infection status is to be applied when the patient without any documentation of symptoms is listed as being HIV positive or non-HIV, HIV test positive or similar terminology. Got it? Okay. Uh, Nothing. Okay, in your documentation, nothing listed like HIV positive or HIV test positive or similar terminology, nothing they have mentioned. Do not use this code if the term AIDS or HIV disease. It it is used, if the patient is treated for any HIV related illness, okay, so you have to use B20 in these cases. Otherwise, you don't have to report the B20. Okay, only HIV related illness they have mentioned, you have to code B20. Otherwise, you don't have to code the particular B20. Clear? Got it. Next condition, patients with inconclusive HIV serology. Inconclusive means, no definitive diagnosis. Okay. Mm. So R75 is the inconclusive code. A patient with inconclusive, they have mentioned patient with inconclusive HIV. Okay, so R75 is the code. Other case, previously diagnosed HIV related illness. Okay, the patient had previously diagnosed HIV. So you have to code. How to code? Patient with any non-prior diagnosis of an HIV related illness should be coded to B20. Okay, B20. Once a patient has developed an HIV related illness, the patient should always be assigned code B20 on every subsequent admission encounter. Clear? Patient previously diagnosed with any HIV illness, B20 should never be assigned to R75 or Z21. Clear? So, if a patient had previously diagnosed HIV related illness, you have to code B20. Okay, when when we code, once a patient has developed an HIV related illness, the patient should always be assigned the code B20 on every subsequent admission. Okay, this code B20 should never be assigned to R75 or Z21. Okay, together R75 is for inconclusive and Z21 is for asymptomatic. Clear? Next is HIV infection in pregnancy, childbirth, and the puerperium. So, pregnancy related HIV. Okay, so here there is a condition. During pregnancy, childbirth, or the puerperium, a patient admitted because of an HIV related illness should receive a principal diagnosis code of O98.7. Is for human immunodeficiency disease complicating pregnancy. Clear? Okay, so in this particular pregnancy related cases, O series of code has most priority than other codes. So if a pregnant lady can affect HIV related condition, you have to code O98.7 is for HIV disease complicated pregnancy, childbirth, and puerperium. Got it? Not code B20. Okay. First you have to code O98.7. After that, followed by B20, you have to code. Okay. Code from the chapter 15 always take sequencing priority. In every, we have in ICD 22 chapter is here. So, chapter 15 is the childbirth, puerperium, pregnancy related chapter. So, this chapter always takes sequencing priority than other chapters. Okay. The next condition, a patient with asymptomatic HIV infection status admitted or presenting for a healthy care encounter during pregnancy, childbirth, or the puerperium should receive code of O98.7 and Z21. There is no symptoms mentioned. Okay, there is no symptoms are seen. You have to code Z21 because Z21 is for asymptomatic HIV. Okay, so no symptoms I have mentioned, you have directly code Z21 to the code. Next is encounters for testing for HIV. If a patient is being seen to determining his or her HIV status, use code Z21. Z21 is at 11.4 encounter for screening for human immunodeficiency virus HIV. Use additional codes for any associated high risk behavior if applicable. Okay, so this case is for testing HIV. Okay, if a patient is being seen to determine HIV status, you have to code is at 11.4 is for HIV virus encounter for HIV virus. Okay. Uh, Use additional code for any associated high risk behavior if applicable. And next case, if a patient with the signs or symptom is being for HIV testing, code the signs and symptoms. And additional counseling codes is a 2071.7 human immunodeficiency virus counseling may be used if counseling is provided during the encounter for the test. Patient with signs or symptoms. HIV testing, code the signs and symptoms. Okay, code the signs and symptoms. An additional counseling code require is at 71. You have to use the counseling code. Next, when a patient returns to be informed of his her HIV test result and the test result is negative, use code is at 71.7 human immunodeficiency virus HIV counseling. Okay, HIV counseling is for is a negative. HIV test result is negative. Code is at 71.7. Okay, if the result are positive, what will be the code? B20. Okay, only positive diagnosis you have to code B20. Next is HIV managed by antiretroviral medication. In this case, AIDS is currently managed, HIV or AIDS, okay, managed on antiretroviral medication. Assign the code B20. Code is at 79.899. Other long-term current drug therapy may be assigned as additional code to identify the long-term current use of antiretroviral medication. So, in this particular case, HIV managed by antiretroviral medication. In this particular case, you have to code B20 as the primary code and the secondary code is at 79.899. Additionally, for identifying the long-term use of antiretroviral medication. Next is for encounter for HIV prophylaxis measures. So when a patient is seen for administration of pre-exposure prophylaxis medication for HIV, assign the code is a 29.81. Encounter for HIV pre-exposure prophylaxis. Pre-exposure prophylaxis is intended to prevent infection in people who are at risk of getting HIV through sex or injection drug use. Any risk of factors for HIV should also be coded. So, HIV prophylaxis measure. In your documentation, the physician documented that the patient is encounter for HIV prophylaxis measure as in the code is a 29.81. Okay. Next is the next main condition is sepsis. Sepsis related codes are important. Sepsis, severe sepsis, and septic shock infection resistant to antibiotics. Coding of sepsis and severe sepsis. Let us check the codes. For diagnosing sepsis, okay, so this is underlying systematic infection. As in the code A41.9, this is the sepsis code. Unspecified organism. Sepsis for unspecified organism. A code from category R65.2 is for severe sepsis. Should not be assigned unless severe sepsis or an associated acute organ dysfunction is documented. Okay. So how to take code from this chapter? Let us check. If a patient has sepsis and acute organ dysfunction, patient had both sepsis and acute dysfunction, organ dysfunction, but the medical record documentation indicate that the acute organ dysfunction is related to a medical condition other than sepsis. So do not assign the code from subcategory severe sepsis. Okay, because other than sepsis they have mentioned, not a sepsis. So do not assign the severe sepsis code. An acute organ dysfunction must be associated with the sepsis in order to assign the severe sepsis code. If the documentation is not clear as to whether an acute organ dysfunction is related to sepsis or another medical condition, query the provider. So you have to code sepsis and acute organ dysfunction only, not code R65.2. Next is coding of severe sepsis. How to code severe sepsis code R65.2. This code contains minimum of two codes. First code is underlying systemic infection. Okay, and second code is severe sepsis. If the casual organism is not documented, the organism is not documented, you have to code A41.9 sepsis code, unspecified. Okay, they have specifically mentioned any type of organism, code the organism first, and the second code is the severe sepsis. They are not mentioned any type of organisms, you have to code sepsis. After that, you have to code the infection. Clear? A41.9 is for sepsis, unspecified organism for the infection, additional code for the associated acute organ dysfunction. Next is septic shock. Septic shock generally refers to circulatory failure associated with a severe sepsis, and therefore it represents a type of acute organ dysfunction. For cases of septic shock, the code for systemic infection should be sequenced first, followed by the R65.21 severe sepsis with septic shock code T81.12. Okay, post-procedural septic shock, any additional codes or the other acute organ dysfunction should also be assigned. As noted in the sequencing instruction in the tabularis, the code for septic shock cannot be assigned as the principal diagnosis code. So, do not take directly septic shock's code. First of all, you have to code R65.21. Only after that, the septic shock code, and any acute organ dysfunction is mentioned, you have to code the acute dysfunction also. Okay, dears. So I will be back on more guideline related video in the next. Okay, I have little busy at now. So I'm stopping. I'm quitting this video now. Next video I will upload more guidelines. Okay, and also in the night, we have a video about our, you know, I'm doing a video or a post related to our giveaway winners.